Hey guys, welcome back to the channel. This is Dr. Bashir with Cypress Oral Surgery. On today's episode, we're going to talk about a very common issue that happens a lot to teenagers, and I'm going to show you how we deal with it surgically and orthodontically as well. So let's jump right in, and we'll get started. So this is a X-ray of a 12-year-old and 12 or 13-year-old, and this person comes into our office, and the orthodontist sent him over to manage this canine. I'm going to show you a couple of X-rays, a couple of pictures here. This is the canine tooth right here, and this tooth is supposed to be growing in this direction. And the problem here is it's going the wrong way, and we're going to help it surgically. I'm going to show you how to do that. All right, here's a 3D X-ray that we have. You can appreciate the canine. It's going in the wrong direction instead of this way. Now what we're going to do is expose it and see if we can push it in this direction in the proper orientation. I'll show you another image of what it looks like. Here's another picture. It gives you a perspective how the tooth is hidden behind this one. Now this is a very delicate situation because if you do a lot of surgery here, you can potentially damage this tooth, and you can also lose this tooth in the process. We did something special. This is called an open eruption, and I'll show you what that means. And this is an image of us looking from the feet up. You can see the canine tooth. It is right there. This is the canine tooth, and what we want to do, we want to pull this tooth in this direction. Okay, so let's jump into the surgery photos. Here is a picture when we do these under a little bit of sedation because these kids it's very comfortable to work in this area. The canine tooth is hidden under the tissue, so this is the lateral tooth here. The canine tooth is hidden in this direction. If I was to draw it out, it's probably pointing like this. Okay. Also, we had to take out this baby tooth. This is a baby canine, so this moves in this direction. Now we took the baby canine out, so this is the socket of the baby canine, and then what we did is we actually cauterized the tissue to expose this canine tooth, and this is the hole we made. And on top of this canine, sometimes there's a thin layer of bone, and you do remove that as well. And now what we're going to do is we're going to bond a little bracket onto the tip of this canine, and so it can be pulled this way. Now the reason why we want to open this up is because you don't want to push against the root of this tooth and you can damage it. So with the hopes of this is called an open eruption, and the hope of this is when you remove tissue and bone, the canine just drops into the palate this direction, and then once it drops, then you can pull it this way. I'll show you how we did this case. So this is the surgical pictures. We attach a gold chain onto this canine. This is what these gold chains look like. This part, you'll put a little bonding agent that bonds to this against the surface of the tooth. So the tooth would be like this, and it's bonded, and then the orthodontist pulls it in this direction. And here's a picture of after bonding this chain. This is called an expose and bond procedure. So we expose the tooth, that's number one, and then we bonded it. This is there, you can see a little bit of bonding composite here. We bond it, and I actually like to put composite over the bracket because the most common issue with these is the bracket pops off. So we really bond these things really well, and then if the chain is really long, we cut it and we just tie it to the ortho wire with a black silk suture. Now the way this is going to work, it's basically, this is a tug of war per se, and what does that mean? Meaning now you have all these teeth hooked to this wire, and now the orthodontist is going to put a rubber band to pull this tooth this way. So now this tooth is in a tug of war against all these upper maxillary teeth, and there's also other teeth in here, and usually what happens is this tooth loses the battle and it kind of gets moved in this direction. And now you can see that the orthodontist took my suture out, and now this is about a month after the procedure. You can see the socket has healed up. This is where the baby canine was. The socket has healed up well. This tooth actually dropped into the palate a little bit, and now you can see here there's a little rubber band that's pulling this tooth in this direction. A lot of times the orthodontist will put it this way, then actually he'll put the rubber band in this direction. So they keep watching the patient to make sure that this canine is actually going in the right direction. Here's an image of this 2 months later. You could see more of the canine tooth. Here's the canine. It's dropped more into the palate, so it's doing what it's supposed to do. And again, you can see the rubber band kind of actively pushing this tooth in this direction. Here's a picture. This is 3 months later. You could see more of the tooth now, and it's really starting to drop into the palate. This is only 3 months later. And again, our goal is to get this tooth in this direction, and we want to stay away from the root of this tooth so we don't damage it, because a lot of times these teeth get damaged if they're pulling too hard, and they're pulling in the wrong direction as well. Now, this is 6 months later, and you can really see now things are coming into proper position. This tooth not only didn't move in this direction, but also now it's moving slowly in this direction. And now the chain that we put on there, the orthodontist has taken it off, and now he's ready to put a regular orthodontic bracket, which is right here, and he's going to tie it to this wire, and then it's going to come into position, and it should look great. So and now you can understand kind of how these things work. I'll show you another case where the teeth were really, really, really high. This is a 10-year-old, but the teeth are really high up there, and you can't put a chain. If you put a chain in here, then you end up damaging the root of this tooth here, and we don't want to do that. So what we actually did is we did an open eruption, meaning we open up a hole in the palate and we let this drop down into the palate before we activate it, before we actually pull on it or put any chains. Again, this is what you call an open eruption. I'll show you the surgical photos. This is at the time of surgery. As you can see, we actually make a pretty big hole in the palate, and you actually almost always have to make a bigger hole because the tissue will heal over, and you want to make a critical size defect so the tissue just doesn't heal across and you can't see the tooth anymore. So in this case, we removed a lot of bone and a lot of soft tissue, and you almost always have to remove more tissue than you think you need, because again, 12-year-olds or 11-year-olds, they heal really well. So you don't want this tissue to heal all the way across. For comfort, we send the patient with this. This is called a periopack. It's basically a dressing that helps protect the wound and helps with comfort. However, young people do experience quite a bit of discomfort or soreness for about 2 weeks from this. This is the same patient 2 weeks later. As you can see, the tissue is starting to slowly heal. This periopack comes off around 2 weeks. If it doesn't come off on its own, we will take it off at the time of the visit. Once you take it off, this is what it looks like. This is what the area looks like 2 weeks later. And again, you want to remove enough tissue and bone. You can see a little bit of bone right there around this tooth. The idea behind it is now you created a path of least resistance, and the tooth is going to drop into the palate first, and that takes about 2 to 3 months. This is a month after surgery, and you can see the tooth now is doing what we wanted it to do. It's dropping into the palate because that's the path of least resistance, and once it comes in here, then we're going to pull it this way. Now, the reason why we don't bond it right now, one of the reasons why we don't bond it is because if you pull in this direction, you're going to hit the root of this tooth, and then you can potentially lose a permanent tooth or cause any damage. So in an open eruption, you really open up the tissue so you can form a path for the tooth to drop in, and usually these teeth move in the path of least resistance. In this case, it moved into the palate. And this is 2 months after surgery, and you can see the tooth is doing exactly what we wanted it to do, and it's going to continue on dropping into the palate. Now, once about two or 3 months after surgery, the orthodontist will put brackets on, and then they'll put a little rubber band to activate this. Here's a picture. This is about 6 months after the procedure. You could see the tooth dropped quite a bit, and now the orthodontist is able to put a bracket onto this tooth, and now they're pulling it in this direction. But this takes a long time. This is about 6 months. Sometimes I've seen these take up to 18 months to get to this stage. So in this scenario, the orthodontist is trying to make room with this little rubber band. So he's trying to expand these teeth away from each other to make room for this canine, and then slowly at the same time pulling this canine into place, and all things are good. There's very little damage, and the most important thing for young people is that we don't damage these teeth that this tooth was behind. This is very important. That's why we do open eruptions in these. Okay, guys, I hope that explains something and helps your understanding of what an exposum bond and what an open eruption is. My next episode will be on a closed eruption technique. If you have any questions or issues, please make them in the comments, and please subscribe. Thank you.